on Labor Day, we had 32,000 cases a day in this country reported. At that time, I was already saying that this was going to be the darkest months ahead.
The flu's not going to stop for COVID. Pneumonia's not going to stop. The strokes aren't going to stop. Nothing's stopping for COVID. So you already are going into a busy season, and now you have COVID on top of it.
On the eve of the election, COVID surging to all-time highs. Hospitals warning they may ration care. For voters, the pandemic is front and center as it continues to explode across the country yet again.
Every statistic is a patient.
We're all trying to keep our cool on the outside. On the inside, we're like, got so many patients I need to see.
For the first time, the U.S. surpassing 100,000 new COVID cases in a single day.
The moment that we are in is unique in history. There's really nothing that could have prepared us for this.
For the second time in just 2 days, the U.S. hitting over 120,000 new COVID cases in just 24 hours.
This is why we went into medicine, to take care of patients, to step up when others needed us. We took an oath to do so, and that's why we're here.
Tonight, coronavirus cases climbing in nearly every corner of the country.
What we're seeing now is what happened, a couple of weeks ago, and it's going to be getting even more because of this widespread spiking that is occurring.
We're going to look back one day and say to ourselves, oh my God, 100,000 cases a day? I wish we were back there at that point. This is not to scare people out of their wits. This is to scare people into their wits to understand that.
I think that every state's getting hit really hard, and you really can't walk by a TV screen without seeing a nurse or a doctor saying that they're overwhelmed and they're reaching capacity.
The whole reason why public health experts recommend practicing these preventive measures is so we can avoid what we're seeing right now. Not only don't we want human suffering, but we know that we have a limited number of staff, a limited number of beds, a limited number of ventilators.
Let's start with the good stuff. Since we don't often have good COVID news to discuss, this vaccine news could not come at a better time.
Even if the shots were available tomorrow, Allison, we would still have months where we had to wait to get the benefits of those vaccines. Then the body has to rev up. It's like building, your muscles. You don't just go overnight to ripped and built. It can take several weeks. That's exactly what the immune system needs to do.
Either way, though, the kind of data that's being reported with over 90% efficacy will still bode really well for shrinking down these numbers and getting us closer to life as we knew it.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.